In the district, access to infertility treatments just got a little easier. The D.C. Council voted yesterday to require insurers to cover medical care for infertility. That means soon more families will be able to afford the costly treatments. Jess Arnold spoke with one new mother who knows this cost all too well, and she joins us live in the studio. And Jess, I think, infertility affects more people than we might realize.
Yeah, Annie, that's right. It's about 11% of women and 9% of men of reproductive age that have experienced fertility problems. And that's according to the National Institutes of Health. Maya Martin-Cadogan is one of them.
I started trying to have a child at 38 years old with my husband. We met at 35. We had 3 miscarriages over the course of a year and a half.
Sixth-generation Washingtonian Maya Martin-Cadogan and her husband had to weigh if and how they could afford IVF, which costs about $20,000 a round. According to the NIH, most people require 2 to 3 cycles to conceive. At the time, with both living and working in D.C., their insurance didn't cover it.
We were like nearly 40 and had saved up our life work savings to be able to afford a house. We wouldn't have been able to both do that and to afford IVF.
Her husband ended up getting a job through New York, which does require insurance to cover fertility treatments. So now they have 6.5-month-old Xander.
That is only thanks to amazing public policy. And so I'm so excited to see that DC is following a host of other states who have made sure to create equity in access to expanding families.
The D.C. Council passed the bill Tuesday, requiring private insurers, Medicaid, and the D.C. Healthcare Alliance to cover diagnosis and treatment of infertility.
This is medical care. This is science. This is what so many well-to-do families have used in order to start their family. And I think it just really opens up possibilities and opportunities for people to be able to both have a career, start a family, meet their person when they meet their person.
Now, in approving this bill, D.C. joins 20 other states in passing fertility insurance coverage laws, and that includes Maryland and West Virginia. Now, this bill is set to take effect in January 2025. Annie.
This is such a big deal, Jess, and it's going to make a huge impact on so many people. Just one more note here. Infertility is just as common as many other conditions that are otherwise widely covered by insurance. For instance, about 8% of adults in the U.S. have asthma, and it's covered by a vast majority of insurers. Compare that to the 9% of men and 11% of women of reproductive age who experience infertility and find themselves going into massive debt just to start a family.